all the attendees, not just in the MENA region, Dubai, but globally. So we'll give people about 1 minute to start in this. As we're getting ready, just maybe for the panelists, what are you guys doing for the shelter in place? Are you guys doing okay, or are your kids doing well, or?
I've pretty much been home. We go out just for groceries and for work. Otherwise, we pretty much stay home. Although in California, a lot of people are riding their bikes, hiking, and things like that still.
That's true.
I've been completely at home. So in Dubai, we've had a strict curfew for a number of weeks. But then even when the curfew has been loosened a little bit and we have windows of time that we can go out, I've still remained at home. And so, because I'm just more effective doing what I do from my home office. The only challenge is that everybody else in my household is at home also. So the children are there. So it's not the same as having a choice of working from home. This is trying to work whilst being stuck at home. So it's a little different.
Yeah. You know what I think is interesting about this whole situation is I think it's made me realize and my family realize how much overscheduled we are with our lives. Now that we actually have a chance to at nighttime to sit there after work and to do things and play board games and do all the things that historically it just seems like life has just been so busy we haven't had that chance. So if there is some kind of a positive light on the other end of this, I think it's a lot of us, some of us have realized some different things, I guess. That has been a pleasant experience.
Ron, I'll echo that because I'm stuck at home with 3 teenagers.
Boy.
3 boys, by the way, who do not stop eating. I mean, all I do is, work, cook, clean, look. And in breakfast, we already talk about what we're going to have for dinner. And it's just kind of like all day long. And so, yeah, it's been a challenge, but at the same time, it was such a blessing. I get to know them a little bit differently and spend a lot of time with them. And now that I'm not traveling all over the world, I get to really enjoy my family, which is really, a blessing in disguise.
No, it is.
I agree with you.
Yeah, I think for me on a personal level, not having to do business travel is as people don't expect it. It's sort of like it feels sort of nice, right? Every day you get to do, work online and get things done. I agree with Ron. This is like that slower pace of life feels sort of like it's a nice experience. Hopefully, even after travel is lifted, we can still have some element of that. And
I agree.
yeah, and then maybe we could get started in this. I think, by the way, again, thank you so much for everyone joining for this. We're pretty excited to have probably, at least in my mind, probably the best panel experts on telehealth to share with you guys on insights on picking platform. I guess before I start, I just want to introduce. So my name's Milton Chen. So I'm the co-founder, CEO of VC Telemedicine. So we've been doing telemedicine for over 10 years now. And we're most well known as the people who created a video telehealth system for the astronauts. In fact, all video communication from the International Space Station done using our software. And let me maybe just turn over the floor to each of the panelists and have them introduce each other. Then we're going to just have them, each of them present a little bit their thoughts in this. Then we can open up this to a Q&A. By the way, in the Zoom, there's chat and Q&A. So if you can type a question in the Q&A that make it as easier to handle this, please feel free to just pour your question on there. We're going to get to as many of you possibly answer them on live in there. How about maybe we can turn the floor to Prentice. Do you want to maybe briefly introduce yourself?
Sure. I'm Prentice Tom. I'm trained as an emergency physician. I'm the Chief Innovation Officer and Executive Vice President for Medical Affairs for Vituity. We're a national organization. We have a few thousand clinicians, and we staff all over the United States. We provide services in emergency medicine, hospice care, ICU, anesthesia, psychiatry, neurology, primary care, post-acute care, and we have a fairly significant telemedicine component. We have a few, probably 600 physicians that are currently providing telemedicine, and we also have various services that we provide through our hospitals. So over the years, I've become familiar with most of the various platforms out there, and as a user and as someone who's had to analyze them for their effectiveness.
Okay, great. Okay, thanks, Prentice. Siki?
Hi, everybody. My name is Siggy Marmestein. I'm a nurse practitioner in my profession. I have been a nurse practitioner for many, many years in many clinical settings. I'm also the CEO and founder of Telehealth Consulting Services. We are a company that is dedicated to help healthcare systems and individual physicians to start telehealth for their practices. And we do so with, knowing again all the different platforms and different offerings that are in the market, as well as workflow designs and knowing the understanding of the patient and the physician side of the equation. I'm very happy to be here. Thank you so much.
So, yeah, Joe?
Hello, everybody. Thank you for having me. My name is Joe Hawayek. I am based in Dubai, a very cloudy and gray sky Dubai today, which is out of character because it's the time of year you expect it to be very sunny. I've been based in Dubai and worked across the Middle East region for many years. Most recently, my role is to run a telehealth company. It was established in Dubai. It's licensed by the Dubai Health Authority, and some of my experiences around setting up a business in Dubai, a telehealth business in Dubai, I'm looking forward to sharing.
Excellent. Thanks, Joe. Ron?
Thank you, Milton. So Ron Emerson, I'm the Global Director of Strategic Development at A&B Global Telemedicine. Pleasure to be here. My background is I have a bachelor's degree in nursing, and I'm an RN. I used to run a large telehealth network in the state where I'm located now for this presentation, which is Maine. And for those of you that aren't familiar with it, it's north of Boston, about 3 hours, and it's where I think the statistic is 90% of the lobster in the world comes from. That's sort of what we're known for up here. AMD Global Telemedicine, the organization I'm with, we've been around for 28 years. We were actually the first member of the American Telemedicine Association, going that far back, and we're in 103 countries and provide a variety of different telemedicine solutions. So I'm just honored to be here and speak on a distinguished panel with other folks who have such a passion to increase access to care and look at how technology can do that. So it's good to be here.
Thank you so much. And I was thinking maybe just to get going, is right now with the COVID situation, it just feels like the whole world just gone from telemedicine is very interesting to become like a must-have. Just feel like within a matter like a couple of weeks in there. I know there's like all these different platforms out there, and even the word what is the telemedicine, telehealth, just video conferencing seems like there's a lot of confusion in there. So I was thinking maybe we can just have each of you maybe share some thoughts about just when you think about telehealth platform, is there certain advice you can share with the audience member in there? That'd be really, really interesting in there. Maybe we can start with Prentice. I know you have a couple of slides you can share with us. Maybe you can start with that.
Sure. I'll go ahead and start with the slides then. I'm going to open my screen share.
Mm-hmm.
Can you see my slides?
Mm-hmm. Yes.
Okay. First of all, just really quickly, I don't believe that the COVID pandemic has changed the move to virtual care. All it has done is been a catalyst for the paradigm shift and sped it up. I think that we were going to move towards virtual care in any event. There are enormous reasons and positives that come from virtual care. I'm going to go over this real quickly, just the cost savings, the immediacy of care versus, at least in the States, if you try to make an appointment with your primary care physician, it can take weeks to get that. And so your care is delayed for a significant period of time, whereas virtual care, you can do it immediately. It's very scalable. It actually, in some ways, improves the quality because of the fact that it's immediately available. So if you, especially for things where you want some type of diagnosis relatively quickly, upper respiratory infections, injuries, things like that, rash, a lot of behavioral issues, those can be taken care of much more rapidly. It significantly improves access. But here's a real key thing. It also allows for disruptive technologies. that tertiary care is not even amenable to. So for example, they are coming out with all these new types of devices like acoustic monitoring devices that can detect congestive heart failure in advance, these voice analyzers that can detect people's moods, and even gait socks that can predict when people are going to fall. Those are longitudinal patient monitoring devices that aren't amenable to an acute care, tertiary care setting. And so actually they're devices that are actually more amenable to virtual care and to some type of longer term intermittent relationship with the patient. And finally, obviously, because the COVID, it does allow for the remote monitoring of the remote care that was really the catalyst for what we're looking at right now. Did you want me to go over some of the key selection criteria? Maybe everyone could hop in also while we're going over them. So these are the criteria. There are many, Milton, and it actually take any one of these. You could spend hours, in fact, days, just analyzing each one of these criteria. So what I would think that the best thing to do is just go over them pretty quickly so that people have a sort of a breadth of understanding of the types of criteria that they should be looking at in selecting their telemedicine platform. And then we could probably have questions and go over, and people, everyone will have a different opinion as to the importance of these. And so I'm not trying to set any prioritization. I'm just listing a lot of them here. So for telemedicine, the reliability of the platform, whether it's always up, how well the connectivity works, it's incredibly important. If your telemedicine platform isn't reliable, that obviously is one of the most significant issues. The user interface, both the ease of use and how it follows the clinician thought as well as the clinician's actions. So the user interface significantly creates efficiency for the clinician if it follows the way the clinician is thinking and the way that the actions occur in that specific setting. The company culture is actually incredibly important. And that means the culture of the telemedicine company in terms of working with the end user and the end user group, because all these technologies require constant addressing, maintenance, modification. There's always things that come up. And if a company has a culture of service, that's actually incredibly important. Whether the platform allows for a virtual waiting room and queuing, related to that are there push-pull notifications, and are those customizable for both the queue as well as data? So for example, if there's specific data that comes back, can the end user determine whether they want that data pushed to them or whether they have to access it? What is the notifications and alerts that occur, and on what types of data can they do that for? Is it customizable to both current technology and adaptable to future technologies? As I mentioned, there's a lot of new technologies that are coming out right now, all types of patient monitoring devices, everything from visual devices to implants to everything. And so is the technology something that you can adapt so that you can connect those various types of monitors? And because this is much more than just an interface with the patient, a visual interface. It's a virtual care platform, not just a communications channel. Is the platform easily amenable to clinical scenarios? So what a dermatologist needs is completely different than what you would use for an emergency department triage. And it's completely different from if you had a home health tech going into the home environment. And so each one of those user interfaces need to be designed specifically for that user group. And because you want to have a single system everywhere, you want a company that's able to create a specific user interface, because how we do our home visit is different than how another group does a home visit too. They have a different patient population. So you want a system that is modifiable for that specific end user. Does the platform interface with the electronic health record? Does the company provide education and tech support? That's actually incredibly important for the end user. You know, especially if the end user isn't familiar with the technology, we really need the company to come in and help provide that support. What are the analytic capabilities? how easy is the data structured and clean at the end so that it can be moved and analyzed, and can it be done real time? Just if we had real time telemedicine capabilities to analyze data, we could look at influenza-like illnesses right now and know if there was going to be a increase in the number of COVID patients in a specific area. We would be able to do that type of analysis. Workflow algorithms. So when it generates patient lists, can you actually put in workflow algorithms so that the end user knows exactly sort of what he has to do with each patient, especially as we move to multiple different end users, and some of them maybe with lesser training, especially in chronic care patients where you may have a nurse's aide going to patients' homes, and they need to know exactly in a very specified way what it is they need to do and which patient they need to see next, especially if things like ED triage. Do you have the ability to do that? And also, can you do group work capabilities? Can multiple people work on the same patient at the same time? Does a platform allow for synchronous as well as asynchronous consultation? So if you have complex patients and you want to get a consult, can you do that on both a synchronous and an asynchronous manner? And what is the way that that information is transferred? Care algorithms and AI support tools is access easy yet secure, and there's a lot of experts here that can talk a lot more on security than I can. Is the company a market leader with access to new technologies? So larger companies have relationships with many of the other tech companies and monitoring companies that are out there, and they understand what's going to happen in a year or two in the marketplace, and they can start to prep their platform to account for those changing technologies. This is an incredibly rapidly changing space, and the ability to have people, to have a platform where they are aware of those changes coming down so that they can improve your technologies is incredibly important. Just a few more. Does the platform allow for pharmacy location and prescribing, and is that automated? Does it allow for a referral and follow-up? Does it connect to your revenue cycle management, i.e. your billing company, or does it even do direct invoicing of the patient? And then does it have call routing, front desk and dispatch capabilities so that you can actually coordinate the care centrally? Milton, those are, I think, some of the key criteria that that we look at when we're looking at a system. And there's many, many more, I'm sure. And I went over them really fast. Like I said, we have such a limited time, and I'm sure everyone has comments on to what they feel are the most important. So I'm going to stop right there. And let me see if I can get out of my screen share and return to the big screen here.
Brandon, that was really insightful what you're sharing. I think I found especially your comment about the culture of the vendor or company work with, because what we find is always like I think telemedicine is not at the stage as commodity in there, right? This is not there's all these things have to be customized to your particular department, your workflow, that and you have this very long, deep relationship in there. It's like if you didn't have a good company in terms of good culture, often you just find it very frustrating to deal with. But thank you so much.
And Milton, I want to add to this too, is like when you look at telemedicine or any kind of implementation, don't do it for what it is today. Do it for what you know your company is going to be like doing in the next 5 to 10 years. As if you build it just for what it is today, you probably will fail in 5 years from now.
Yeah, I agree with that. In fact, I think it's almost like I feel like this is like the story of washing hands, right? It took like many decades until that become a common practice. I feel like the COVID has accelerated that, something that naturally will happen anyway. That might take maybe 10 years or 5 years, now shortened into a couple of months. But this definitely will be you should definitely plan for this, like for what will you do after COVID. I guess, CJ, maybe we could turn the floor to you in there. Maybe you could share some of your thoughts on the telehealth platform.
Well, Tom, thank you so much for that. It was very insightful, and you're right, there's a lot of things to consider. One of the things I do want to tell people, besides the fact that you have to think futuristically, when you look at telehealth program, you have to look at what is going to be. A lot of us did not see this coming, but some of us did know that there's going to be a need for very large implementation of telehealth programs across the United States. And some of even the health systems who did start telehealth early on had to increase their capacity very, very quickly. And one of the things that happened was technology failed them because of the internet, or because of capacity, or because of servers, or things like that. These are things that we always have to think about, and security is one of them. So we really, thinking about all of that is you need to have the right person to help you implement your telehealth program. I want to always remind people, you think you can do this on your own, and everybody in your system may be knowing a lot about how to do telehealth. But the reality is, if you get an expert to help you implement your program, somebody who has done this over and over again and has a lot of knowledge in the technology and the patient interface, the workflows, you're most likely to succeed when you don't try to implement telehealth all on your own with the internal capacity that you have. I'll stop there. Those are a few questions.
Okay, terrific. How about we maybe turn the floor over to Joe. Maybe Joe, you can share some of your insights on telehealth platform.
I was thinking, just mulling there, what could I add after the two experienced experts already? But really, I think of it from the Dubai perspective. You think of the Dubai-based regulations or the standards put out by the Dubai Health Authority. Remember, the Dubai Health Authority is a combination of different regulators. So they regulate the healthcare sector in Dubai. They also are a provider of government healthcare provider to the general public also. But then things that are, let's say, technology and video regulation and all those security matters that you were highlighting fall under a different regulator called the Telecoms Regulation Authority. So it is about navigating both sets of regulations, but we look at them as standards, and they're called standards. So they're almost like a recipe book rather than something to try to avoid or try to satisfy, or rather than a negative feeling around them. They were really a recipe and a manual. So they set out what should be in place for a service to be licensed in this country, and some of the things that really make a lot of sense. But sometimes it's good to see them in black and white, and helps people, satisfy them and follow these standards. So a couple of simple things. One is recording consent from the patient. Pretty simple, but pretty effective. Recording the entire consultation, and this only needs to be over voice. So the voice recording is a requirement. Video can be chosen not to be used, as you're aware. It's very helpful sometimes from a perspective of patient, let's call it bedside manners, and it's nice softer aspect for the patient to see their doctor, and doctor see this patient, and all of this. They can smile to them, they can give them a more feeling of human care. But clinically, technically, sometimes you're better off with an image of something that the patient might have sent in, or a recording of something, or a lab result, things that don't need to be over video. And indeed, we found in the over the last year of running this business that many patients or customers or members elect to turn off video on many occasions. They feel they don't necessarily need to be turning it on. So the recording really is about the whole medical record and all the consultation, but also this video, the voice component is the important one. And the third and final highlight, and I think it's been covered already, but just the feature or the requirement to have ability to run audit reports. So the ability to run across the whole platform reports of, let's say, any adverse incidents, any number of this, what kind of consultations are you doing, what kind of prescriptions are you doing, all of these kind of reports, from an audit perspective, but of course, quality control and patient safety also. Those would be the top three thoughts from me.
Great. Joe, thank you so much, Sharon. And I guess maybe we'll turn it to Ron. How about you've been in this space for a very, very long time, the outsourced aspects. How about maybe some of your thoughts?
Yeah, I appreciate that, Milton. So, I'll start sort of from a different level. So I think, Prentice did a great job in talking about some of the more specific items. But, one of the things that I think is just key when you're choosing your telehealth platform is just to take it up that initial level and ensure that you have the leadership and executive decision-making within the organization that from a strategic level that you're going to integrate telehealth in the way that you provide services to your given population, right? So because if we don't do that, I think we all realize, and we've all seen it that have been in the industry, you'll have a few doctors that are doing it and you'll hear about this great program and all of a sudden one doctor moves away and then the whole program basically disappears because it wasn't really worked into the strategic vision and fabric of how that organization wanted to provide care and within the organization. So I think that's very important to the patients. The next thing that I think is just key on that is once you have that vision and you have the executive buy-in from a strategic vision of how you're going to provide care, is when you choose your technology platform, and I'll take it like another level higher, is sort of let the application drive the technology. Figure out what you want to accomplish within the organization from a clinical perspective, and then put the appropriate technology in place to meet that need. And how many of us that have been in the industry see folks do it exactly the opposite way? They buy technology and then they figure out how they're going to use it, which of course it happens way more than what it should. And then we don't have the success that we all want and we know that the technology is capable of. So the application needs to drive the technology. So you figure out what you want to do and put the right technology in place to meet that need from a clinical perspective, from a patient satisfaction, from a clinical efficacy perspective of how well you can provide the care based on the intent. The third thing that I think is very important, healthcare is changing, right? I think as we all know, and previously, we have some clinicians, physicians on the line, but before, and it depends on where you're at in the world, but it was really about, hey, I'm someone's sick, and then they go see the clinician, and then we fix something when it's sort of broken, right? But what we're seeing now is we're seeing that change, of course, and we're seeing quality-based care, and we're seeing clinicians being paid differently. So that goes to like capitated rates and all of these different delivery models. And what telehealth allows you to do is it gives you more touch points, right? So I kind of have a saying, and our company does is, when everyone in here is familiar, if you're in healthcare, maybe we have some IT folks, but there's called the care continuum, right? The continuum of care, which means like from the home, then they go to the primary care office, and then they might be escalated to maybe a rural hospital for something. And maybe that rural hospital can't quite handle that clinical situation because of complexity. And then they might be escalated to a tertiary care center. So when you look at your platform, I think it's important to look at that scalability that you can reach across what we call the virtual care continuum, right? So if you want facility-based telemedicine where you have diagnostic capabilities, that's great. But also within that same platform, be able to have, based on the intent of what you're trying to accomplish, to be able to have increased touch points across that continuum of care, regardless of where your people are located. And that becomes more important as we, we're all incentivized as much as we all don't want. We have people here that own companies, and we have people here, we sell and stuff, but hospital systems are incentivized too. Public systems too. They have to provide equity of care. We all have our incentives of what we're driven to do. So look at those things, and I think one of the key things is to be able to touch people where they're located and across that continuum. The last thing I'll just touch on is, Dr. Tom did a great job, Prentice, just sort of the checkbox items that we all know is, what we want for telemedicine, we don't want people to have to reinvent the way that we provide healthcare. What we should be doing is healthcare organization and companies, and Prentice talked on this, is we want to integrate into the normal workflow of what clinicians try to do every single day, right? And that's very, very important. So be able to have those hooks to be able to integrate into the workflow of organizations, as Prentice said, to be able to push and pull data, populate data. All those things are important. And then also, and some of that can be like HL7, and then just ensure to validate the company that you're working with. I've been doing this a long time. I work for $1.5 billion company. I've worked for smaller companies, and just ensure that they have the right level of certifications and everything to protect yourself, and some of those ISO certifications and stuff that give you an assurance of policy and procedure and quality from that organization that they've met those basic standards. So, I'll leave it at that to start out with. So thank you.
Thank you so much, Aaron. By the way, so like for the audience members, we have a lot of, please definitely feel free to, there's chat and Q&A, definitely type your question in the Q&A, then we're going to just, open this up to really just answer the question, the things that you care about. I guess I'm really grateful for all the panelists in there to have them share their insight. Again, this is the biggest industry expert in the world, not just Nina in there. I think the way I think about this is, I think I almost feel there's like 4 questions when I think about that. The first one is like, does it work or not? Specifically around, right now, there's a lot of video centric for telemedicine, but just there's certain cases like Joe said, like telephone works just as fine, so you don't need to have video. But really, it's, if you have that video center, like, does it work? Does it mean, do they have a dedicated infrastructure, or you share with the general video conferencing space? Like until you have a dedicated infrastructure, during that peak time, right, you can get a lot more reliable service in there. And then the second thing, you said it's productive or not. I think one of the common mistakes people make is people assume telemedicine is just video conferencing. And I think you're going to find that also the articles now written in the last couple of weeks, right? People find you do your great video conferencing tools in there. Next thing you know, your productivity is 50% shot because you're missing all the stuff that Prentice sharing is like, can you route the patient? Can you tag them? Can you make it efficient as a provider? If you don't have that, you're like, you can do telemedicine, but if you have as a clinician, you can face a 50% productivity hit. You're not going to do this that often afterwards. Then the third question is, could you get paid in this? So the reason for this case, especially in the US, we're finding like all these people excited about telemedicine, but the reimbursement is went down. Like now we find that often you just like, just spend the time, whether you're in MENA or another country, talk to the payers, figure out the right. So when we do a survey, our customer base, we find often people just filling on they're filling the coding wrong in there. There's a different way you can talk to a coding expert, make sure this is getting paid in there. Again, end of days, right? If your platform doesn't support you to get paid, I don't think you're gonna stick around that much in there. Then the last thing is, can you do telemedicine that's better than in-person care? Again, this is why I really like what Prentice shared with you, right? There's a lot of interesting things you could do that allow things like this, or predictive analytics, you can actually allow you to do actually better than in-person in there. So that if you have a platform that support that, then now this is not just to do something for the COVID, but this will become, you can actually do much better in terms of care. Yes. So,
Milton, I noticed there's quite a few individuals that are writing, and they're saying they use Zoom. And I just want to emphasize what you said. That is not telemedicine. That is simply a communications tool. That is like saying I have a pad of paper and a pen, and that's my electronic health record. Or that's my mechanism. It's simply it's unstructured. It actually doesn't allow for any uniformity. It doesn't allow for input of data. If you're doing studies, if you're in an emergent situation, like maybe right now where we are in the world, and you need to absolutely communicate with somebody, then use it. But if you're trying to create a virtual care program and change the way care is delivered through your organization or your society, then that's not a long-term solution at all.
Yeah, thanks for sharing that in there. Yeah, I love your paper pen analogy in there. I thought that was like perfect.
I also think, if you don't mind me answering, I see some of the questions that are coming through about how do you choose the right program, or how do you know which one is the right program? We kind of took you through some of the basics, but it's very individual to what it is that you're trying to solve, and what is it for your organization specifically that is important right now, and then what is important for it in the future, and can you build into that capacity? The problem with Zoom or the phone or any one of those other systems is that it allows you to only do one patient at a time, which is a problem. If you want to do more than one patient at a time and you want to have big capacity, Zoom will not allow you. I mean, here we are on Zoom now, but you're not going to have a group session you can do on Zoom. But if you wanted to do something that is more collective, a lot of patients coming from a lot of different places, this is where those kind of programs fail. So if you want to have a system that will send your patients to different kind of departments or allow your patients to come into different physicians or nurses, you may want to start with a nurse triage and then go from there to another system, and then from there to another system. All of that cannot be done with Zoom or Skype or WhatsApp, which a lot of people are using right now. Another thing that I'm seeing people are talking about is, can I give patient my WhatsApp? Yes, you can do that, but that is your patient now has your direct number and they know you now and they can call you at any given time, which puts you on the hook for that patient and kind of in their back and call. So I don't suggest people to use WhatsApp or their personal WhatsApp to discuss information with patients. If you have to use something, then use something that is not your number and not yours. That's just my suggestion to what I'm seeing being discussed here today.
That's okay. Thank you so much for sharing that. So maybe we'll just dive right into, I know there's questions that come bubbling up in there. So I think Maria's asking, so what are the approved platforms specifically in the UAE for telehealth? I guess maybe we'll direct the question to Joe, since this is your backyard.
Yeah, I'm probably the choice. You're right, Dr. Milton, but still, although I offered to discuss the standards from the Dubai Health Authority, I'm not from the Dubai Health Authority. I'm from a private sector business that's regulated under the Dubai Health Authority. So I can't quite answer that question. I think they'll have to check with the DHA, the Dubai Health Authority.
Yeah, maybe for the
I will say just one simple thing, and it's been referred to in the discussion already, that with COVID and with this pandemic, it's been a catalyst for speeding up access, and really a necessity and an urgent necessity to give people access to care without them having to leave home and all of this. So the approval around the platform has been permitted over this period more broadly and widely, just as a let's say response to the pandemic. It isn't going to need to continue. It is a temporary approval that they've permitted. Whatever means people need to use to deliver telehealth is okay, as long as they remember the standards to follow.
Thanks, Shane. By the way, for the audience, Maria, so if you search for in the Dubai, there's actually recently, I think a couple of days ago, they did publish a list of approved telehealth vendor platforms already. So any of those, when you pick up, they're good to go. Then, as Joe mentioned, they are planning to broaden this more in this. So another question from the audience is, are common platforms like Zoom, like Microsoft Teams, are they safe from things like patient confidentiality perspective? Maybe we'll direct this question to Ron. What do you think about that? Ron, unmute the mic. Yeah.
I'm sorry. Yeah, there's what we're going through right now with COVID, and then there's the post-COVID, right? I think there's some specific certifications. As far as safe goes, I think the two things you need to look for, of course, is there's kind of really three things. One is, of course, you want to make sure that the platform has authentication. So there's security and there's privacy, right? So security is basically ensuring that the data is encrypted, and when it's in motion or data is at rest, right? So we want to ensure that that's in place. The second thing is the privacy piece. Who has right to what and who can access what based on the actual application, right? That's the second thing. The third thing, though, that I think those platforms are missing, and depends on where you're at in the world, but is basically the due diligence to ensure that that they understand the same level of security and confidentiality that you do as an organization. And I'll just kind of use the US as an example. In the US, we have something called HIPAA, the Health Insurance Portability Accountability Act, and then we have what's called the High Tech Act. And I think what's important is, so regardless of where you're in the world, is that healthcare organizations, regardless of where you're at, they have certain levels of security and privacy that they need to adhere to, right? So if that organization, if you, regardless of where you're sitting right now, if you're going to entrust a vendor or somebody to manage and share and utilize your and transfer your patient health information with your patients, you want them to understand that they basically need to adhere to the same level of security and privacy standards that you do as a healthcare organization. So those organizations have things, they have security. I mean, if you ask them, they have security, but they're, as Dr. Tom said, Prentice, they're basically video communication platforms. So the answer is yes and no. They have the security, but do they have the back-end validation? And what I mean by that is, so the companies on here that do this, you know, what we do is we have to go through certain certifications and internal processes, both administrative and physical safeguards, that we can basically authenticate and sign off into healthcare organizations and say, yes, we understand, we provide these certain levels of security and privacy, just like we're your organization, and we're meeting the same basic standard that you are as an organization. So it's kind of a tough question, because I don't think you can just say no, that they're not secure, but are they secure? So like if you're in an organization like ours, our people are trained, and I'm sure you know Milton and others that do this, you know, we offer business associate agreements in the US and other places. Our people are trained in confidentiality. So like if, you know, you want somebody to know, so here's my concern coming from that world. Let's say with Microsoft or somebody that does not offer some sort of BAA. Let's say that that person has the ability to come in and to be able to like view what's happening right now, right? Let's say there's an engineer. So an engineer at night has the ability to come into your call. You don't even know that they're there because they haven't been trained, and maybe they don't realize that what they're doing is highly illegal because they're actually looking at patient health information. Organizations that do offer those certain validations and security, such things as a business associate agreement, their people are trained to realize how to handle patient health information and that it's wrong. So, Milton, I don't know if I answered that exactly right, but it's kind of it's a complex question, right? Because the answer is yes, it is secure, but there's a lot of other things to it rather than just say, okay, the connection we're on right now is secure. There's more to it in healthcare than that.
Yeah, I mean, I think you answered perfectly. In fact, thinking is like, if you take a company like Zoom, it's a phenomenally great company. We're using this tool out there. We probably saw that their engineers previously were using Facebook SDK. Again, it was not maliciously, but just the fact that they decided to go down that path. I mean, if you actually did a virtual console on Zoom, you were actually leaking data to Facebook, and they were tracking. It was one of those things where, like Ron said, if you're a company that focus on healthcare, they will never even go close to that. But the fact that they're not a healthcare company, that's just no big deal. Some engineer decide to say, that's a good thing, or just Facebook, who cares, right? Or even the way that Zoom, right, they have all the decryption key stored in China versus like you have all these country-specific, like security issue. Now next thing you know, who cares, right? I think this again, so I think it's not just like does a company say, is that secure or not? It's almost going back to the apprentice opening thing. Like, do they have that culture? Do they live and breathe what you do? If they don't, chances are whatever they say is just a leakage about to happen, sometime in the future. The next question is about from Phil. So he's asking, so it would be good to draw on maybe you guys' experience on overcoming the challenges of adoption, both from the clinicians and the patient themselves. Maybe I'll direct this question both to Siki and Prentice. Maybe Siki, you want to take it?
Yeah, oh my God. So I started about 68 telehealth implementation, big, large organization, very large organizations. I'll talk about Kaiser is a great example here, is one of our largest organizations, 13 million patients. Obviously, anything from 0 to 100 and something year old. And how do you build a program that will fit all of them, right? And then that everybody can work with. One of the things that the challenges, and I think that Tom spoke about before, is to build a program that is good for all our different physicians and different clinicians, as well as different patient populations, different backgrounds, different expertise, different languages, and different knowledge of the healthcare system. So I always say to everybody, just keep it simple. It has to stay simple. One of the things that we have learned is if we start too much, too fast, we get too complex, We try to do too many things at once. We put in a lot of peripherals into a system. We'll put in a lot of different areas. We lose the customer, and we definitely lose our physicians who don't have the patience to deal with all of that, and they don't have the time. So keep it simple. And one of the things that we learned very quickly is, how do we keep it simple? We try to make something that is good for certain population. We pilot that, we talk to the patient, we ask the patient about their experiences, we get their feedback, we get the physician feedback, and then we put that together and we say, okay, what do we need to dial up or dial down? So always get people's feedback. And one of the things that a lot of people don't do is, and how we overcome it, is you don't build something and continue building it without getting the right feedback from both your physician and from your patient. You want to hear from the patient all the time. How was your experience? What did you like? What you did not like? And how do you, how would we do this better for you next time? Of course, you're never going to get to one platform fits it all. It's going to take a little bit of trial and error. And we had a lot of trial and error, but you need to be patient and you need to be persistent, but definitely get the feedback of the people who you're working with. Another big barrier, just to let everybody know, is technology itself. Especially I'm looking here to people that we have from all over the world. Here, even in the United States, we have many, many counties and states where we don't have internet. And so if you're going to build a program in a place when there is no internet, don't build a program that patients cannot go into, right? So if you are in India or in other areas when there is no internet, the patient doesn't have a phone or a cell phone, don't build a program the patient cannot access. Make sure that the patient that you are serving have the technology and the knowledge and the know-how of how to use that technology, and that they have the capacity to do so.
Super,
I'm gonna let you answer the rest.
Prentice.
Yeah, I think this is, it's a multifaceted question, first of all. The challenges are very different for the clinical teams and for the patients and for the system. They all have different challenges. I think one of the key things is, if you really want this program to be adopted, you need to consider clinician workflow. So that's why the technology has to have the ability to queue patients. You have to have the ability to determine how you're going to push and pull data. And then you need to look at the clinician workflow. So if the clinician has a busy primary care practice, they don't want to be interrupted in the middle of a patient because a telemedicine call is coming in. That throws off their whole day. So what needs to happen is you have to sit back and look at your entire system and how am I going to restructure clinician workflow. One of the reasons Kaiser was successful is they dedicated clinician time. They said, okay, we're changing your work day, and this portion of your work day is committed to telemedicine, or and other groups have assigned specific physicians to take all the telemedicine call, because you can't just take this technology and dump it into a practice environment and say, here's the technology, now you can start communicating with patients. You have to have thought this out, and it has to be done in a way where you can actually improve the efficiency for the clinician. And then what happens when the person that's now doing the telemedicine is no longer the primary care physician? How does that information get back and forth? That's why I was saying there has to be ways of taking the patient queue and the patient data and transferring that information back. And each group is going to want it different. So you need to decide when information is going to be pushed and when information is going to be pulled. So I think the patient side in some ways is easier. On the patient side, they need to have some type of device where they can access the telemedicine technology. On the system side and the clinician side, you need to understand how that information gets into the medical record, how you're going to bill for it, how clinicians are going to interact. And so that does require a significant amount of work.
Hey,
Thank you
Milton, I
so
just
much.
have one thing to add to that, if that's okay. So, it's really interesting because, a lot of us have been doing this a long time, and I sort of thought about it. I was like, what are the things over the years when I ran a telehealth network, and then on this side of it that I've been challenged on, right? And I kind of like who are the people within an organization to get buy-in, right? And if you sort of think about it, we have four, right? Of course, the patients are first. We have that. We have the clinicians. They have to feel comfortable with what they're doing from a clinical perspective. And then we have, of course, we have IT staff who has to manage all this and bring things out. And then we also have, of course, the reality is that there's a bottom line, right? And we have to have a bottom line. So if you kind of put that in three different levels, I kind of break it into like three. Is one thing is patient satisfaction. We're there to serve patients. That's why we're in healthcare. So, and then clinician satisfaction. If you look at a lot of studies, right, it's above 90th percentile for telehealth. So we know patients like it. Clinicians, it can vary based on the platform, what the intent is. So what's the patient satisfaction? The next thing that I think you need to look at, because when you go to your organization, like you say, you're going to get challenged in all three of these things. The patients like it, what are they at? So the patient's one thing, and the clinician experience, as Prentice talked about. The next thing is important is clinical efficacy. Can you provide the appropriate level of care, and does the clinician feel comfortable with what they can do over telemedicine? It's their license, right? It's their license on the line. Are they going to be practicing and comfortable with what the intent is of the technology? So I think that's a very, very big one. So put the appropriate technology in place so that they can provide that efficacy. And then the third thing that you're always going to get challenged on in an organization is there's the bottom line, right? And it really comes down to two levels for me: is how do you increase revenue, or how do you decrease costs? So if you're a private organization, just to be very open, they're looking at how they can increase convenience, reach out, increase market share, get more people inside of their organization, but still provide quality care. That's very true. And then if it's a public sector, it's about efficacy. It's about equality of care and access to care, because regardless of where you're at, and then they want to decrease costs and do things more efficiently. So I think if you address those three items and at least think of those things up front, because you're going to get challenged on all three of those, I guarantee it, as you walk through that process, or you usually do, I think you'll be okay.
Yeah, thank you so much for sharing. And so another question is about, so often we do telemedicine, so we get this quite frequent, right? So you could do a video chat and so yeah. What about in terms of remote physical examination, all the stuff you will do it in person? Maybe I'll direct the question to Joe. Maybe I'll flip the question a little bit, maybe from an insurance payer perspective. Now, do you need to do these for a remote physical exam, where you find really the video chat by itself is sufficiently valuable?
Interesting question. Also very difficult to answer in one go. But in general, no, we don't necessarily need a remote testing kind of, let's say, remote monitoring or remote kind of tele monitoring kind of. What we do have is relatively more analog or manual, which is things like if doctor determines they need to see a lab test, a blood test, something like this, they can order one. They can either send the patient to a facility, to a lab to get that done, or we can dispatch somebody from the lab that visits the patient either at home or at work. They can take these kind of things. So it's relatively more, as I said, manual and not very digital. But I'm aware of a number of other providers in Dubai who have tele monitoring type things, for example, for diabetics and things like that, and they're able to update their attending physician or their doctor looking after them and see things on almost real time, and they can see alerts of that nature.
Okay. And in terms of remote physical exam, there's great company like Ron's company, right? They have, they're like for adding devices in there. I definitely think there's like, if you need to do the remote patient exam, there's a lot of devices out there. In fact, I would say, going back to Apprentice, maybe his anchors sharing this, right? You can do video chat. If you actually work with a telemedicine company, there's a natural extension. Yes. If you only need video chat, they have that. But if you also need to do remote patient exam, the same platform will allow to support that as well. The next question is, so we have is like, what platform can we use? Now, I'm going to maybe flip this question again. Ron represents one of the best, oldest, and best telemedicine company. I'm going to ask Ron, if you cannot recommend your own company, which company will you recommend?
Wow, that's a tough question.
That's a hard one.
That's a really hard one. Yeah. I probably won't mention a name. I think, I think that, Prentice has done a really nice job at really outlining and with his initial slides, all the key considerations. I think just ensure that the company, just a couple of things. One thing is, as I said earlier, make sure that based on what the application is, make sure that they can meet that need, right? Just don't think just because the word telemedicine, they say telemedicine, that they automatically can meet your needs. Because telemedicine can mean a million different things. I used to be in the board of the American Telemedicine Association a number of years ago, and that's when we were still fighting over what telehealth meant, what telemedicine meant, all that stuff. So just be careful when you hear the word telemedicine. Don't just automatically think it meets your needs. Look at the intent of what you're going to do. That's number one. The second thing is all of the things that we've talked about again and again is just workflow consistency, and then integration into your workflow. Make sure they have the hooks, HL7, all of these different things, or APIs, whatever it might be, to integrate into your traditional workflow of what you do. Certifications, and then cost for sustainability. That's one of the things we've all been challenged with telehealth, to be very open, is the sustainability of it and what makes sense. So there's a lot of good platforms out there. Just based on what your need is, I think you have to be very specific and choose based on what the actual application is, and then use that company's strength.
I want to one thing. I'm a consultant, so I don't have one company, but I can tell you one thing. Don't go with anything that just came out to market yesterday and then will be gone tomorrow, and you will stay without nothing to show for. It is important that you choose a company who is well sustained, well stable, that has good track record, has done a lot of work, and can really be there in the next 5 to 10 years. And as I said before, remember not what you need today, remember what you're going to need tomorrow. We are going to have more patients. There's going to be more disease. We're going to have more epidemics. We're going to have more needs. So remember what the future looks like, and make sure that company that you choose is a company that can actually sustain that future for you as you're looking forward, and that it's been there for a long time. That's the most important thing I can say about a telehealth choice.
I think there's so many different criteria that it's not like there's one best company. There is a company that fits each user's needs the best, just like vehicles or anything else. I was trying to build a rabbit habitat with my daughter, and we had to take some weeds out of the ground. And so I went down to the hardware store, and I'm explaining I need to chop into the ground. This guy hands me literally a 60-pound pickaxe. And I said, well, I don't think that's the right tool for my job. It may be the right tool for someone else's job, but everyone has different priorities and different needs. I can say that VC has an exceptional culture in terms of working with people. And I'm totally agnostic. I'm not affiliated with any company at all. And so it depends on what every company needs and what everyone's looking for. But you need to go back and look at what your own needs are and look at all these different criteria and then prioritize. If you're just a dermatology group and you have a very specific need, well, there may be one of the platforms out there that has created the best user interface already for dermatology. And they may not be any one of the large players. And so you need to look at what your needs are and how you're going to deploy the technology. I think what Sigi mentioned earlier, you need to look at how that technology can adapt to changes because there are enormous tech changes coming. Right. Because all we're talking about here is the telehealth platform. There's all these other patient monitoring devices and technologies that are coming out, and all these types of data analytic tools. And so you need to see how this technology is going to be able to adapt to those changes. It's a very, very rapidly changing environment.
Yeah, thank you so much for sharing. I agree with the timeless in there. I feel like the tool is something not don't pick something just like that you need to do like immediately now, but chances are you're going to need all these extra things you're going to have to do. It really is about it's not just doing video conferencing, it's almost creating that digital practice, if you will. And then if you have to switch between all the different platforms, do this, you can create so much chaos on your provider patients there. One thing, by the way, as we're coming to the end of the hour, maybe we could have a final question, which is, there's a lot of excitement about AI and telemedicine. They seem to, there's a lot of just synergies in there. Maybe we could just, as we're cracking this thing, maybe we could share with each of the panelists, just, what's your thinking in terms of what are the most interesting things you think like the AI in terms of adding a telemedicine could be impact, or just your perspective in there. Maybe we can open this up with maybe Prentice.
I'd love to take a stab at this. This is one of my favorite topics. I think there is enormous potential and future with artificial intelligence, specifically with telemedicine. When you can get large data sets, it will advance artificial intelligence significantly. And I think that virtual care allows for that type of data acquisition. What artificial intelligence is just algorithms do is it allows for a much wider variety and spectrum of healthcare providers. And so it significantly reduces the cost of care. There are studies done in the US already, and for complex and comprehensive care management, when patients are discharged from the hospital, you can use someone with less than a nurse's aide educational level and have them go to the home environment, and they can reduce the risk of readmission by as much as if a cardiologist went to the patient's home. And so you can create protocols that allow a much larger spectrum of healthcare providers and professionals provide care. And that's why this is such an amazing technology. There's such a value proposition. And with this entire area of artificial intelligence, creation of algorithms, the ability to use the data from the virtual care visits, it's just an enormous area with so much potential.
But that's what it is. It's just a potential. I want people to understand AI is not there yet. We need to build a lot of data for AI to be really effective and act as a human, if you may. So for those of you who want to buy something just because there is an AI component to it, remember, we're not there yet. We are a few years away from an AI doing all those wonderful things that Francis just said. But we get in there, and it will be an amazing technology once it's fully developed and can do what we want it to do.
Absolutely. We're at the 2-megapixel camera right now. We're not at the 30 megapixel camera.
Not yet. Not just yet.
But just to add on to that, Prentice, you said something I agree that's super exciting is, telehealth really provides a platform where we can get those large data sets when we look at predictive analytics, similarity analytics, right? So we can start to use this information in the future to help sort of guide and provide better clinical outcomes. But, I even think that, as CG said, that there's we're not there yet, but there's sort of, it's not AI, but there's even, sort of different ways that we can collect data for telehealth to increase efficiency. We talked about wait times. You can use clinical pathways that basically collect information before the provider actually even sees the patient, so that they at least have a general idea based on what the patient's there for to be seen. And this might be direct to consumer, even diagnostics. So there's ways that telemedicine can actually streamline the process to increase efficiencies and with the system if we use these right tools, that when they even fall short of complete AI, which I think is important. We're starting to see some of that pop out.
Ron, I totally agree with what you're saying. So for example, we're in the environments we practice, we now use one neurologist at like 25 hospitals to take call, because otherwise you have one neurologist on call at every hospital, and that's just not cost efficient. Whereas now you can have, through telemedicine, you can have one neurologist available for multiple facilities at the same time. The scalability and the cost efficiency is very, very significant.
Great. How about Joe? Maybe you can have the wrapping thoughts on AI and telemedicine?
Nodding furiously and agreeing a lot. The discussion around AI isn't there, like colleagues are saying. But we can start to have application of AI in very specific areas. So the triaging entry point and first contact point with the patient is very useful. We can collect the information, the history required for that. Then when the doctor sees them, they have this more available. So these sorts of let's say family history, medical history, allergies, and that could be helpful. But also help them navigate to the right appointment with the right doctor also, and these kind of things. So there is application there. And certainly from a performance, or let's say analytics around the claims performance and how things are being charged, what are the types of diseases being seen mostly, how they're being treated mostly, and these kind of things, that adds a lot of insight to decision support people, whether they were on the clinical side delivering care and seeing what's being successful, or from the, let's say, financial business side, and also seeing how that balance is being struck.
Yeah, thank you so much for that. I know we ran over time a little bit. Also for the audience member, there's a lot of more questions we didn't get to. Apologize for that, but we'll actually post this to the panelists, so we'll have a written answer posted on the website soon in there. Again, I just want to say, like, thank you so much for everyone for joining us. And really, I'm super grateful for all the experts. It's such a treat to hear and learn from them. Again, thank you so much, everyone, for joining us.
It's a real pleasure,
Thank
Milton.
you, everybody. Thank you so much.
Thank you, everyone. Appreciate it.
You.
Have a
Lots
great
of
night or
health
day.
to everyone. Stay healthy.